Hi, welcome to your tutorial for Module 5 Special Populations. This is for your WWCC Nursing Assistant NRST 1510. Remember, this is an overview, so please go to your Health Center 21 and complete the modules, quizzes, and tests there. Okay? Just some quick reminders. Make sure you have read the dress code. It is under course information. You're responsible to know that. If you haven't already, start looking and buying your scrubs for clinical. It's a black pants and a white top, and black or white shoes with no prominent logos. So keep that in mind when you're purchasing your stuff. Also start thinking about your certification test. Okay, we will go over that in lab, your applications, dates, what's needed, the cost, things like that. If you want to look more into that, there is a packet under course information in regards to that. Okay. Also, final will be taken day 2 or day 3 in your lab. In front of the instructor. It will be proctored. 50 questions, 500 points, and multiple choice. After a few days before or a week, depending on your instructor, she'll release a study guide for that. And if you have any questions, so let us know. So on with your tutorial. This is going to be just an overview. Make sure you go in and go through their PowerPoints and do all their assignments there. So special population, we're going to go over pediatrics, elderly, dealing with deaf, cognitively impaired patients, physically and developmentally impaired patients, restraints, and then of course you'll have your module test on Health Center. So this is a lot of information. Make sure you know how to study, how you're learning that suits you. So you're taking notes, maybe screenshotting, maybe you're typing them, maybe you're making flashcards. Whatever you're doing, please continue doing that. Okay. Remember, this is a quick overview, so I'm going to try and keep it short. Your introduction to your pediatric patients, they're going to go over the age categories. Of course, I do have it broken down in this little nice picture. There's infants, there's toddlers, there's early childhood, middle childhood, and then adolescence, okay? So make sure you know your age categories, okay? So you can take care of your patient and their family to your best ability. Each pediatric category, age category, will have also certain developmental tasks that they should be meeting. Also, when you're taking care of them, you'll be noticing if they're not meeting those tasks. So making sure that you're taking note of that. Also, when you're learning this and going through Health Center 21, it is a great idea to know the stages of development and starting to memorize that. That will come into play not only in CNA, but also if you are pursuing a degree in nursing or be a PA or a doctor or something like that. So make sure you know those stages of development. When you're caring for pediatric, you're not just caring for them, you're caring for their family also. So making sure that you're taking everything into account when caring for them. That the pediatric patient is your priority. When taking care of them, remember that they're young, vulnerable, and they're dependent on others. They can't just get up and do whatever they do, and they do need to be checked on, and they're your responsibility. Okay? We need to meet their basic needs to make them reach the top of that pyramid, which is happiness. Okay? So you need to make sure that they're taken care of, that they feel like comfort, safety, security, and love. Okay? Just like our Maslow hierarchy of needs, we want to meet the needs to get up to self-actualization. Okay? So when you are communicating with your pediatric patients, make sure you know that stage of development because it will indicate how you want to communicate with them. Make sure you also, with all of them, watch your tone and make sure you're not invading their privacy and their space. Okay, keeping the touch to a minimal, or if that's what they want, or if they need a hug, to make sure you give a hug. Use appropriate age words. Make sure you're always being simple, honest, and explaining what you're doing and providing privacy. Health Center 21 will go over different healthcare conditions for the pediatrics, breaking it down to congenital, which is present at birth, and other conditions that are visible after, usually after 2 years of age. Sometimes it's earlier, so keep that in mind when you're going through those diseases and conditions. Then Health Center will move on to your elderly population. Elderly patients you're gonna see an increase in that in the healthcare system, whether you work in home health, hospital, long-term care, and maybe even the young at hearts senior center, you're going to start seeing this aging increase because of the baby boomers are starting to get older. So just I kind of go over the myths and right here, so keep that in mind when you're taking care of your elderly population. And elderly is just 65 and above. I think sometimes when we use that, you already get a sense of, oh, they can't do much. But it's not that. It just means that they're in that category, 65 or older. Okay? So make sure you know the myths. The Health Center 21 will break it down a little bit more for you. Make sure when you're taking care of your elderly patients that you keep in mind that they do have developmental tasks also. But their body functions do decline, and their brain does still create new synapses. However, sometimes they can't recall their memories very frequently. So keep that in mind. That is just something that happens. All of our systems do start changing inside of our body. So keep that in mind also, that you might not be the same person or have the same as what they were when they were 40. So everything ages in us. That you're interacting with them just as the same as what if they're 65, whether they're 55. Even if they can't comprehend it, you're still explaining a task and telling them what is going to happen and what is going to go on. You don't want to just go in and do whatever you need to do. Please maintain their self-worth and give them the dignity and respect that they deserve. Okay? And this is just some making sure that you don't violate their rights. They do have rights. If you've never seen this Bill of Rights, Google that and read through the Bill of Rights. It's very informative. Lots of elderly do live at home. They also live in skilled nursing and long-term care facilities. Common conditions that you're in, diseases you're going to see with elderly patients. Remember, they can have one or all and lots of other ones. Arthritis, diabetes, osteoporosis, cerebrovascular accident, that's a CVA, abbreviated, which is a stroke, chronic obstructive pulmonary disease, congestive heart failure. Health Center 21 will then go over this dealing with death, first going through the grief and dying, and then going through the stages of grief, which are denial, anger, bargaining, depression, and acceptance. Remember that it is a continuing cycle, and sometimes maybe everyone is different. Maybe they spend a day or even an hour in denial, and they go back to anger, and they can move back and forth through the system or stages. Okay? The final stage, of course, is death. Sometimes it's unexpected, so you need to support that family that is dealing with that unexpected death. Moving them also through the stages of grief. As a caregiver, you're going to be open, receptive, and flexible. Patients' attitude will change day to day, and you need to be also knowing that and helping them deal with the stages of grief. Maintain their dignity and be empathetic and considerate. Listen to them. Sometimes that's all they need. Also, when dealing with their emotional statuses, you're also dealing with their physical needs. You're providing fluids, you're giving them oral care, you're giving them skin care, whether that's a bed bath or getting them up and toileting, offering the bed care. All because they're dying doesn't mean we don't go in and show them dignity and respect that they deserve. Make sure to report any changes to the nurse. Remember, dying is a private affair for the patient and their family dealing with this death and dying process. So provide dignity and respect and privacy for them. Make sure that you're not faking an attitude or giving them attitude. Remember, they're going through it, so maybe at one point you walk in and they're angry for no reason. They're not taking it out on you, it's just the stage that they're going through. So respect that and move them back. Offer spiritual needs if they verbalize that they need something. Even if they haven't verbalized, maybe ask the nurse to maybe offer something for them. If they are dying, the nurse or the doctor might discuss hospice with them. Remember that the hospice agencies are there to provide a natural process to this death and dying. They're also there to control the pain better, so they're not having to call the doctor. It helps the family and friends move through the stages a little bit more. I don't want to say easier, but easier with it because they're having that more that support. They're also getting the education on the stages of death. They're also going to provide legal and financial counseling. To be in hospice, you have to have a MD, a medical doctor, say that you diagnose that patient in 6 months or less with their life. Sometimes they do live longer than that, and that's up to the doctor and hospice facility to keep them in hospice. I just want to quickly go over there is signs of death and when it is approaching. So you should know that so you can report this to the nurse, and also so you know, and it's not a surprise when you start seeing it. When they do pass away, there is, of course, signs for that. Common signs, pupils are going to be dilated, no pulse respirations, they're going to be cold, so if they're coughing and heat. They probably haven't urinated and defecated, involuntary. Their body might be a different color, which usually is purple. They're going to be a little bit more stiff, which is the rigor, and they might have a slight odor to them. So keep that in mind when you go in. If someone does pass, be respectful. I think that even if they're not dying, you should provide respect to all your patients, whether they're elderly, our age, or even if they're passing away. So be respectful. Even when you're doing post-mortem care, you're being respectful and you're providing standard precautions for them. Cognitively impaired patients, you're going to see a lot in the elderly population, which is going to be more your dementia, Alzheimer's. Okay, and that's just that the changes are occurring in their brain. They're losing a little bit more cognitive function. And remember, with dementia, there is different stages. Okay, treat everyone with respect. All because the changes are occurring doesn't mean you're just going to go and violate those patients' rights. Mental illness is a cognitively impaired patient. So you're going to see different mental illnesses depending on where you work. So be aware that there are tons of different reasons why a person's having a change in their mental status. And keep it in mind, if it's abrupt and sudden, making sure to report that to your nurse or your healthcare provider. Also, in that cognitively impaired patient parameter is your suicide patients. Knowing suicide, signs and symptoms of suicidal patients is something you need to be aware of, especially now with social media. Yeah, sometimes you'll see those symptoms online. Also, with your friends and family, maybe your home health. You want to be aware of what's going on so you can report those changes to the nurse or your healthcare provider. Also, Health Center 21 is going to go over your physically and developmentally impaired patients. Physically, the common physical impairments you're going to see is visual, of course, glasses, their sight's going to be deteriorating. Hearing, they're not going to hear as well, and speech. Okay? All because someone might not be able to see doesn't mean they can't hear. So don't treat them also with respect and give them the sense of dignity. Okay? Developmental disabilities. Remember, these are chronic conditions that are caused by mental or physical impairments. Okay, and I just listed some types right below that. Remember, with all of the special needs need to be taken. Change your behavior and with them, and make sure that you're being respectful. Also, be more cautious. Make sure you're following standard precautions, washing your hands, and helping them not get an infection if they're more prone to that. The last section in this module, Health Center is going to go over restraints. Restraints are ordered by the doctor but initiated by the nurse and the CNA. So it's usually to maintain safety with the patient or the patient and healthcare providers. So they might be restricting movements so they can't pull out tubing, maybe an IV, maybe so they can't cause harm to themselves. So it's usually the last resort. We want to try other alternatives, maybe giving a book, sometimes giving blocks to a child, anything that we can do so we don't have to use a restraint. If, however, restraints are ordered and initiated, we're going to be documenting, checking them every 15 minutes and every 2 hours. So frequently, we want to make sure that they're on and in place, that they're not causing skin damage, that they're having circulation to those areas. And if you're noticing anything, maybe you need to change a restraint, to notify the nurse or the healthcare provider so we can make changes accordingly. Okay, remember, all of our patients are different. We have a care plan for each one, and we want to make sure that we're meeting the needs of each patient. Okay. I think that concludes our quick tutorial for Module 5. If you have any questions at all, please email, call, or text your instructor. Give them about 24 hours and then text again or email them again. And then if you're still not getting any answers from them, please go ahead and notify me. I am the CNA coordinator. You can find my contact information under your Blackboard contacts. So again, if you have any questions, let us know. Have a great day.